Yeah, so I'm a family practice physician in Madison, Wisconsin, and have done a lot of environmental work for, gosh, it's been almost 30 years, I would say, with all the things that my husband and I have been involved in. Well, I've done a lot of things, for my own lawn or garden area or, landscape. Um, One is just to ignore it. Honestly, or my husband mows the lawn. That's good enough. It starts with changing your attitude. It starts with embracing um, that monoculture lawn is not going to be easy to maintain unless you use harmful chemicals to to the ecosystem, and you have to prioritize that your health, your pet's health, ecosystem health is much more important than having that monoculture lawn. Because it takes a lot of work if that's what your goal is. So you first have to decide that it's more important to be on the side of nature, which is many different plants interacting in your landscape. Actually, just stopping using them, just stopping using the organic or the herbicides, not organic herbicides. Yeah, doing, adopting organic lawn care practices. Whatever that means. And there are many ways to do that. There are, more prescribed ways with the aerating and the overseeding and, putting on a natural fertilizer and weed suppressor like corn gluten. Um, but also just eliminating lawns, and using more natural landscape. We can only do epidemiological studies that um, look at populations of people that are exposed versus not exposed to a chemical and compare them and see that the rates are higher. So when it comes to 2,4-D, for example, there's studies that are done on farmers or other applicators that show that their risks for certain cancers are higher. And specifically, there's been some linkages to non-Hodgkin's lymphoma. When it comes to children, the concerns we have are there are no, numerous concerns that, for one, they have a long cancer latency, meaning that they have a long time to be on this planet and to be exposed. And so chemicals they're exposed to in childhood could affect them many years later, and to link that is really difficult. The other thing is that kids are more exposed because they're playing on the lawns and they're closer to the ground and they're, rolling around on the surfaces that have been sprayed. And so they're absorbing that into their skin more readily, whereas adults don't have those same behaviors. They also have more hand to mouth behaviors. So there's all these risks that kids have that are different from adults. And to go on with that, their livers aren't as mature and their brains are developing. And so when it comes to any chemicals that they're exposed to, all of those factors come into play. I'm walking into a clinic to get, my pregnancy care, and I see the little lawn signs up that indicates that they've just had these lawns sprayed with herbicide. And it just occurred to me how wrong that was, how the clinic was, not protecting us, not protecting its patients. You get this pushback a lot that the EPA has approved use of these chemicals, and so they must be okay. But when you look at and you kind of dig deeper into what the EPA is saying, or what those what for example, the re-registration of 2,4-D, what they're saying is that they're interpreting the data. There's a group of people interpreting the data. And what they're saying is that they don't think the risk is high enough. This is what they say. The risk isn't high enough to the general population for us not to use these chemicals. So we're going to re-register this chemical for everyone to be able to use. Um, so I was mentioning earlier that epidemiologic studies are really difficult to do. It's really hard to tie a cancer to a chemical because we have so many different exposures in our life. It's very hard to figure that out. So if you're waiting for that golden study that's saying that your hospital's chemicals making your people sick, it's not going to happen. Um, so we've always encouraged, when I say we, I mean I've worked with a couple nonprofits that are working on this, is to adopt the precautionary principle, which is if there's any risk of harm by a chemical, that instead you should use precaution and not use it, rather than waiting for, something that definitively tells you that that chemical is causing harm. When you look at the interpretation of the studies on 2,4-D and cancer, these are from a while ago now. The interpretation is that there appears to be a link, but it's not significant enough that we can say for sure there is a link. But that's so true of so many other, if and I'm not an epidemiologist, not a researcher, um, but when I've looked at other associations between chemicals and health, um, it when you learn of the stories, for example, of communities that have had higher rates of cancers, and that there's been, for example, paint factories in New Jersey that were dumping their chemicals in the river, and people are getting it in their drinking water. It seems obvious that those chemicals are causing the cancer. But when you try to actually pin it down with a study, it doesn't pan out in the same way, just because of how these studies are done and how the links are, made. So you can't depend on epidemiologic studies to give you a definitive answer. And so if you understand that in the first place, then um, there's where the precautionary principle comes in. But oftentimes, regulation and decisions about use are made for other reasons. And so that can be put off to the side as something that's not important or isn't important enough.